to the Ward 8 race. I believe we have in random order was Treyon White, Michael Austin, Yaida Ford, and Stuart Anderson.
Councilmember White, you should be able to speak now.
Councilmember White, are you there?
Yeah.
Okay, you're on for your candidate statement. You have 3 minutes.
We may have lost him because
His connection, Councilmember, your connection's really bad. If you wanted to try disconnecting and rejoining, that would be a good idea. Kent, did you want to move on to the next candidate?
Yes, let's let Councilmember White disconnect and reconnect to see if we can get a better connection. And while he's doing that, we'll move on to Michael Austin.
Mr. Austin.
Are we live? There we go.
You are live.
Good evening, Gertrude Stein. My name is Michael Austin. I'm a fourth generation Washingtonian. I'm an attorney and ANC chairman in Congress Heights. Ward 8 has the largest LGBTQ plus population in the District of Columbia. This includes youth, which the city defines as ages 13 to 24. The district has done a great job at supporting our middle-aged, established members of the LGBTQ plus community. But we haven't addressed many of the gaps that remain for our younger members of the queer community east of the river. These include homelessness as a result of homophobia and opportunities still limited for our trans community and resources for our aging LGBTQ plus individuals are really starting to be stretched thin. So an endorsement for me would really be an endorsement to show that you're committed to a member and a council member who is going to promote, push, and advance LGBTQ plus issues, and that the Gertrude Stein community is committed to east of the river, since we do have the largest LGBTQ plus population in the District of Columbia. I'm a true ally, and I dare say an accomplice to the LGBTQ plus community. And I much prefer to listen to many of the Ward 8 LGBTQ plus residents that we have and your concerns than try to impose my own views and thoughts. I'm very clear that I'm limited in what I can bring to the table beyond a listening ear and to learn from each and every one of you. And so I plan to do that today. I plan to do that on the council, and I plan to do that for the next 4 years as the next Ward 8 council member. Thank you.
Thank you. Moving on, the next one I believe is Yaida Ford.
Hello. Okay. All right. I can start my video now. Can you hear me?
Yes, ma'am.
Okay. Let me scoot this back just a little bit. So thank you, Gertrude Stein. It's a pleasure to be with you all. My name is Yaida Ford. I am in the race for the Ward 8 council member seat. I have a history with Gertrude Stein. When I worked for Jim Graham, who was the first openly gay Democratic member of our council, I was the liaison to Gertrude Stein. And so it's just good to be with you all again. So, you know, I am running, and I'm definitely the best candidate in the race. And these issues, the issues facing the LGBTQ community are a priority for me. I'm an attorney with a civil rights background, a very extensive litigation background. I'm also a trial lawyer, and I have litigated discrimination in our federal courts and in our local courts for a very long time. Indeed, some of my clients are members of the LGBTQ plus community. I have intersected with our hate crimes law and experienced a lot of frustration litigating issues as it relates to discrimination because of the way that the law is. And that's one of the reasons why I'm running. I've been coloring inside of the lines for a long time as a trial lawyer, and it's time to help adjust those lines. So I definitely support Bill 23-435, which reevaluates the defense that an assailant can use when they are a suspected assailant, rather, when they are charged with a hate crime. I think the law needs to be tightened up so that you can't just avail a defense that you didn't know somebody was gay when you attacked them. That's something that needs to be addressed because we have seen a spike in hate crime against our LGBTQ community. I also think it's important to note that the spike in crime against Black trans women is an issue that needs to be discussed. So I support creating and initiating local community fora on these issues that are affecting and letting the LGBTQ community say, these are the issues that we want to discuss.
Who's got in a fight?
So I can hear other people talking while I'm talking. So I also, sorry, I got thrown off there. I just heard somebody else's voice, but also I think there should be a study of local businesses to look at hiring practices into the inclusivity of the LGBTQ community. I think workforce issues are an issue, and this kind of goes into the decriminalization of sex work. We have a lot of LGBTQ members of the LGBTQ community who find themselves forced into a place of sex work because they're experiencing discrimination on the job or in the workplace, and there's little opportunities for folks who may have a criminal background and as they're looking for employment opportunities. So I definitely support just starting a study of local businesses to look at their hiring practices and how welcoming they would be to hiring members of the LGBTQ community. Also, I support creating special workforce housing for LGBTQ youth and transgender women that provides wraparound services for them and will connect them with employment opportunities within DC government. I mean, we talk a lot about, we heard during the last forum, there are vacancies at Office of Human Rights. Wouldn't it be nice to be able to plug members who have specialized training into Office of Human Rights who are members of our LGBTQ plus community because they understand the issues and that would be a great opportunity to transition some of them into some of those job opportunities, and it creates sustainable employment and it deals with the socioeconomic issues that are facing a lot of our LGBTQ plus members.
Oh, thank you, Ms. Ford. You're out of time. Thank you. Thank you. I believe, can we try to get Councilmember White back to see if he's reestablished a connection?
Can you hear me?
Yes, sir.
Yes.
All right.
Much better.
Thank you. My name is Treon White. I would like to thank the Gertrude Stein Democratic Committee for the work we've been doing over the past couple of decades. I've been a member or guest for about 8 years. I want to thank those who have paved the way and created a voice like Phil Purnell and other advocates along the way when it wasn't popular. For me, I'm running for re-election because I am the person who can identify with several different issues in the community. Those that I don't identify with, I like to listen, learn, and act. And so I've been acting. So if you look back at my history as being a council member here in Ward 8 on the City Council in 2019, I supported the Intersectional Discrimination Prevention Act of 2019. I also co-introduced the Essential to Council Supporting Passage of Equality Act Resolution of 2017, the Sexual Harassment Data Collection and Reporting Act of 2019, the Care for LGBTQ Seniors and Seniors with HIV Amendment Act of 2019. And so when there's an issue involving LGBT issues, Treon White has been a consistent voice there. Over the years, I've been trying to go on a listening tour and figure out, what are some of the issues. I've heard that there's a lot of violence inflicted on people who identify with the LGBTQ community. I also heard that there's been discrimination in the job place. I also heard there was a lack of wraparound services for those trying to find housing. So what did I do? Not just talk about the issue, but acted on the issue. I supported Casa Ruby and bringing a location to Anacostia in conjunction with Union Temple. In fact, I met with some members of the LGBTQ community, more specifically transgender community, a couple of days ago. In fact, there was a Smile wanted to come to Ward 8 and they asked me for a letter. Immediately, I submitted a letter and I got some pushback from ANC commissioners. and I never backed down. I still stood by them. We went to the opening. We supported their opening of a housing facility right here in Ward 8. So I'm just not listening and learning, but I'm acting on what I learned. I have a whole lot more to learn. But as the councilman of Ward 8, you're going to see a consistent voice on issues affecting the LGBT community and those in the family. So I would love to get your support at the Gertrude Stein Club. You are doing a remarkable job, but Treon White is the champion for LGBTQ issues right here in DC, more specifically Ward 8.
Thank you, council member. Did Stuart Anderson join?
No, he did not.
Okay, let me see if I can. Okay. I reached out. Maybe he'll be able to join us before we're done with this section. But if he's not up yet, we may as well move to.
I received an email, and apparently the campaign manager is looking for a link. So
I sent it a few minutes ago.
okay.
Why don't we go ahead and move to questions, and then if he ends up joining us, we can, after the first question, we can have him give his opening statement.
Yeah, I think that's right, as far as keeping on time, because it's such a long program.
All right, sounds good. So I'm Fennett Narapil for those just tuning in with the Washington Post, and I'm going to be moderating the Q&A portions of this endorsement event. So to start off, we're entering a budget season that's likely going to end up in reductions in city services. So we're going to be spending the coming months as lawmakers decide what to prioritize and where to make trims. So what program or agency of interest to LGBTQ Washingtonians would you say should be prioritized for protection in the upcoming budget season? We'll start off with the incumbent, Mr. Councilmember Treon White.
Thank you. So some of my priorities in the budget, as I've talked about before, tweeted about, put on my social media, is around housing inequities. One thing you hear from the LGBTQ community is that they lack access to quality health, quality housing. And I think that that has to be prioritized, and it's something that we should not sacrifice in this budget. I think wraparound services, education, also business opportunities. I was listening to a gentleman who identified himself as bisexual. He talked about all the entrepreneurship thoughts that he has, but don't feel like he gets the support he needs to do those services. So we've met a few times about incorporating some of those services inside of our recreation centers. Those are the types of things we would like to see in the budget. I oversee youth and recreation affairs on the DC City Council. Also, I look forward to pushing some of my colleagues to keep LGBTQ issues in the forefront of our conversation. I also supported Check It, was a Ward 8 business in our ward. I was very integral in making sure they got $2 million in the budget to provide a wraparound services, a business opportunity right here in Ward 8 when it wasn't popular, when no one else was supporting it. And so those are some of the things you want to make sure that's in the budget to support the LGBTQ community. I also have a broad spectrum, not just LGBTQ, but just people in general, issues around economic development, issues around creating a quality health service in the ward, and you'll hear more about that in my upcoming.
Thank you, Councilmember White. We are out of time.
Thank you. Sorry.
Next up is Mike Austin. What program or agency of interest to LGBTQ Washingtonians would you champion during budget season?
So in the upcoming budget season, to really prioritize our LGBTQ plus residents, I would definitely say housing. I think housing is a big one. substance abuse treatment, I think would be a great one to ensure that we have mental health support services and wraparound services for our residents who are experiencing hardship, but definitely want to try to prevent homelessness. And so I would say the Human Services Cluster Agency would be a big one too, so that we can provide the wraparound support services for our residents when they're experiencing those type of traumatic situations. Unfortunately, homelessness for our LGBTQ plus population extends beyond age, extends beyond race. And so we really have to be bold and forward thinking in how we address that. And so we're going to need to really put our money where our mouth is to ensure that our residents, when they're going through the most difficult times generally, that they have the support from the district and know that the council members are there for them.
And before we move on, Stuart Anderson has joined us, if we could loop him in. Thanks.
All right, so we'll take a break from this question to allow for Stuart Anderson to make his opening statement.
Okay, can you hear me?
We can.
Okay, all right. So I started a little early. I thought we didn't start till, well, anyway, let's get started.
Let's get started. We're happy to have you.
Okay, so basically, my name is Stuart Anderson. I'm running as a candidate for the Ward 8 Democratic Council. I need your vote to become your next council member. I'm a native Washingtonian, deeply rooted in Ward 8. I want to partner with you to ensure that your voices are heard, that your issues are heard, and that you're well served. The issues that impact you the most, issues such as access to hospitals. So I want to support things in the budget that target, that address the LGBTQ agenda and the health disparities. I also want to look at the things around the First Amendment of guarantees such as your freedom of expression. Everybody should have it. And I don't think that the LGBTQ community should, have it any less than anybody else. I'm a native Washingtonian. I live here. I'm moving on the theme of one aim, one mission, one ward. And that's for all of us to work together. I'm formerly the community engagement specialist for the Anacostia Coordinating Council. I'm the founding executive director of Family and Friends of Incarcerated People, where I've worked with all sorts of young people who are connected to criminal justice system, to include members of the LGBTQ community. I'm also marketing manager of something called Day 8, where I'm reaching out to all types of individuals, to include the LGBT community, to get them involved in the arts and things of that nature. I also work at the Central Theater. I am the co-chair and logistics coordinator for the Martin Luther King Peace Walk and Parade. I also am the vice president for the Parkland Turner's Library. And I want to make sure that the atmosphere in the libraries are conducive to LGBTQ community. I currently am working. I'm a graduate of the University of South Columbia, and I'm currently working at CCAP, which is all about social, emotional, and academic success for children and their parents. And we also shaping and fashioning and looking at that, to also support members of family members of young children of individuals who are involved in the LGBT community. I'm involved in a network of ESIN, that's the Early Childhood Innovation Network. So I'm working closely on the grounds of the family members and structuring that. And I want to make sure that I support LGBTQ community in all of my endeavors moving forward. And so I hope that I can get your support tonight, and I hope that I can get your vote for the Democratic primary. Thank you.
Thank you, Mr. Stewart. Fennett, back to you for the questions.
All right, with Stuart Anderson's opening statement complete, we'll go back to the first question, which is, what program or agency of interest to LGBTQ Washingtonians would you prioritize for protection during budget season? So Yaida Ford is next.
Thank you. One of the top areas for me is the Office of Human Rights. I litigate extensively there, and it's slow. It's a difficult, OHR is a difficult agency when you have clients and you're trying to bring justice. And obviously discrimination in the workplace against LGBTQ plus individuals is a huge deal. And we have vacancies there, so I would fight to protect against budget cuts. And that would be an agency where I would advocate that we cannot cut the budget. I mean, as it stands now, there's not enough support at OHR. Also, human services for those members of the LGBTQ community and our community at large who now find themselves, they were on the brink of poverty before COVID-19, but they find themselves relying on those services. We absolutely cannot afford to cut there. The Office of the LGBTQ Affairs, there's only, 3 people staffing that office. We definitely, I would fight not just to protect it, but that office needs more support. And on the housing piece, it's easy to sit and say, oh, I'm going to fight to protect housing, but will you advocate for more housing specifically for LGBTQ youth and our seniors? So, certainly I would be the advocate in the midst of all of that to fight for that for more, even in the midst of what we're dealing with. Thank you, Bennett.
All right, Stuart Anderson, what can the LGBTQ community expect from you during budget season? What programs or agencies of interest would you fight for?
Definitely, I would look towards strengthening the mayor's office, which focuses on the LGBTQ community. The current budget, and one of the question is, I said that I would look at its budget to see where the greatest needs are so that we could put more money into that community. That agency is designed to basically absorb all of the data and information and come up with the best approach. And so I want to be able to work with the Office of Human Rights as well as the mayor's office to ensure that members of the community get the full services that they deserve, just like everybody else in our community. Homelessness is a big issue for some of our younger LGBTQ members in society, in our city, and even in our ward. And so we have to be looking at putting more programming in place and creating a situation where we can also develop larger grant access for the LGBTQ community.
All right, with that, we'll go to the second question. Ward 8 is among the hardest hit wards for the HIV epidemic, and the district is not on track to meet the mayor's goal of cutting new HIV transmissions by 50% this year. The city has had particular challenges in reducing new transmissions among Black women and gay and bisexual Black men. So what would you do as a council member to bring an end to the AIDS epidemic and address these disparities? We'll start off with Stuart Anderson.
Thank you for that question. That's another area where we have to get much better at. And again, I turn to the mayor's office on the LGBTQ affairs, because it is through that office that we can propagandize the necessary precautions. We have to attack in a broader fashion by getting more information out. Information, one of the things that I always say, as a community engagement specialist working for several organizations over the last 14 years, one of the things I always stress is we got to put it on paper, especially for east of the Anacostia River. So we have to invest in putting the information on paper to reach some of the pockets, and we have to put money into some ground teams to just go out and pamphlet and leaf. We got to make sure that people understand how to avoid the sexually transmitted diseases, how to find help once you contract it, and where that help can be located. And so one of the things we want to do is push for that here in Ward 8. We want to have that included in the hospital.
All right, thank you. The next person up is Ms. Ford. What would you do to address the AIDS epidemic?
Yeah, thanks, Bennett. And it's Yaida. I know he's calling me Miss Ford. Like, I feel like I'm back in second grade when the teachers couldn't pronounce my name and they started calling me Miss Ford when I was like 7.
I'm very familiar with this as Bennett Narapill.
So, thanks. I think that, this starting at early ages. Again, when I was in school, I mean, there was a huge push on safe sex and making that a big deal. And I think we've kind of gotten away from that a little bit. But I think we need to reinforce like those old, the old way of informing our community, especially our children. And getting that instilled in them at a very young age so that they're valuing themselves, they're valuing their bodies. Our children go through a lot of trauma. So talking about safe sex is one of the last things on their mind. Certainly sex can be a coping mechanism for some. Others are sexually traumatized. So they're, early on, our kids are not valued and they're not valuing their bodies. So we have to reinforce that. It can't be such a taboo thing to tell a Black girl that she's a queen and that she needs to value her body, and to tell a Black boy that he's a king, and that being a man, doesn't mean, having babies all over the place and doing, being a man is standing your ground, and focusing on being responsible, and educating yourself and being able to take care of a family. You should be proud of that. And that's what a man is. So I think we need to get back to doing that in our schools. I think we also need to engage the artists and the artistic community to do community outreach with the community on this issue. There are creative and innovative ways to do that, and we need to employ them. Okay, thanks, Bennett. I could go on and on.
All right, Mike Austin, what would you do to bring an end to the AIDS epidemic?
Yeah, so AIDS, for our LGBTQ plus community is unfortunate, and it definitely needs to be addressed. Irrespective of gender or sexual identification, AIDS continues to be an issue in our community, in Ward 8, and in the Black community. And so it is something I definitely want to target and micro-target for our LGBTQ plus residents, especially those in Ward 8. I would say that first, I think we need to really wrap our arms around our residents who are already experiencing AIDS, and make sure that we have supportive services for them, using our, whatever committee we may get, in our second term, and really negotiating with the chairman to get some services for our residents, for those who are already, dealing with AIDS, to make sure we have adequate treatment and, a robust outreach program at OHR and other agencies at DOH, et cetera, so that we're really targeting and micro-targeting our young people as well to prevent new cases as well. Unprotected sex and, other means of transmission still are prevalent, especially with drug use and sharing of needles, et cetera. And so that is something I really want to focus on, and ensuring that our schools have a strong program and, supportive services, officers, behavioral health techs, and those who can really focus on the prevention for our young people, but really focus on our current residents. And finally, I would say those who are dealing with it right now, I want to make sure
Sorry.
I got a lot of ideas.
All right, Councilmember White, what would you do to bring the AIDS epidemic to an end? And as an incumbent, what have you been doing?
Thank you. I think that's a great question. So one of the things I've been doing to address the issues around AIDS and HIV in our community is to support the work of the Whitman Walker Clinic. We are enhancing services. We built a brand new facility on the St. Elizabeth East Campus. I supported that work and continue to do advocate to support that work and make sure it's funded and continue to be in the budget. I've also been a strong proponent of advocating for those who are exposed or predisposed to health disparities in general. One of the things that we do have to continue to support is medicines and technology like PrEP and PEP. Those are some of the things that we know that's been working to keep people alive longer and keep people safer. I have to also echo that we have to do more education in our community. I think that when DC was at the height of the AIDS epidemic, we flooded money into preventive measures, but as time grew on, we kind of got away from it. But there are still individuals who have tested positive or can be exposed to test positive, and we have slacked on that. And so I've been working with several advocates in the community, such as the Whitman Walker Clinic to enhance service.
Thank you, Councilmember White.
Thank you.
And I just want to ask you a follow-up question, Councilmember White. You mentioned the importance of daily PrEP as an HIV prevention strategy, and we've seen with HIV and other infectious diseases the importance of science driving decisions. Can you explain your recent comments on Instagram suggesting that you wouldn't promote coronavirus vaccines?
So there has not been a corona vaccine created as of yet in the nation. And so I know there's been a lot of money and research going into it. And I'm always skeptical about vaccines being given, particularly to the Black community. So I like to learn about it. I like to understand it before the actual post you're talking about was about jobs in DC government, and someone misconstrued that and took it left field on what I was saying. And so I'm always interpreted. And so I redirect that to say that we're talking about jobs. We're not even talking about the vaccine. And I would be promoting anything to people that I represent without having the knowledge of what it does.
Our third question is not going to be quite LGBTQ specific, but we know that health disparities are a problem among the LGBTQ community. And with Ward 8, Mayor Bowser recently announced that she had reached an agreement for a new hospital on the St. Elizabeth's campus. So but we haven't quite seen the details that are going to go before the council later this year. What do you see as essential features for any new hospital deal in Ward 8? We'll start with Stuart Anderson.
Thank you for that question. I'm glad to be able to take this question on. This is the foundation of my campaign platform. We need a hospital in Ward 8. We'll take it east of the Anacostia River, but we need it in Ward 8 more than any other ward specific. But we gotta have, as part of that, trauma 2 level capability. And what that means is we gotta have the specialty care services for the ward with the largest amount of seniors, the largest amount of young people, of children, the largest amount of trauma. And as part of that trauma, we're also talking about mental health problems. And we're talking about how do we treat, we gotta have that in a hospital, and we really need that in the hospital that's in Ward 8. We have to have a trauma-informed approach to how we take care of all of us, to include the LGBTQ community.
Commissioner Mike Austin is next, and I'll also note that he was the former vice president for the current United Medical Center, which is set to be replaced.
So the question is just you said it's just in general, the details.
What do you see as essential features for any new hospital in Ward 8 that's in the deal that's going to be presented before the council?
Absolutely. As the only person in this race who really, taking deep dive into healthcare, even with our own current council member, healthcare is essential for Ward 8. We just haven't seen any urgency to take a deep dive into it at all, especially with this new hospital deal. And so with that, I think a level 2 trauma center at the very minimum is necessary, regardless of what the certificate of need may lay out. We do need a trauma center so that in level 2 to ensure that when there is trauma, unfortunately, in our communities, that our residents aren't having to go to west of the river or just going to UMC to be stabilized at the GW operated emergency room. So I would say level 2 trauma center, that's especially. Next, I would say high-risk obstetrics are imperative. Our residents are still having children. And so I would say high-risk obstetrics and at least a level 2 trauma center are imperative.
Thank you. Next up is Councilmember White, who as the incumbent will actually get to vote on the deal. So Councilmember White, what do you see as your top priorities in the legislation that's going to be submitted before the council for the new hospital?
Thank you. So one of the things that we need in Ward 8 is not just a hospital. We need a complete healthcare system. Ward 8 has some of the highest health disparities per capita in the country. And we've been advocating for a level 2 trauma center. I know the public would like a level 1 trauma center, but we're advocating for a level 2 trauma center. We have given pushbacks to the administration over and over again about what we need. We've opened up several different healthcare service centers in the ward in the last 2 years, and we continue to push forward. One of the things we know is that we have to have the specialty cares in our community. We have high diabetes, we have high kidney failure, we need an obstetric unit in our community. And we experience a lot of trauma. And so you'll see me on the front line advocating for union participation, advocating that we have doctors of color practicing in our community, and make sure we got a holistic approach to addressing medicine and health right here in Ward 8.
Yaida Ford, what would you push for in a new hospital deal?
Thank you, Fennett. I would definitely advocate for a community-based model where people are coming in and a doctor saying, okay, did you eat? Do you have a place to sleep? because our residents lack the basic essentials, and that's sometimes how they end up in the hospital. I also want to point out that the proposed 136 bed facility, even if you had all these specialized things, 136 bed facility it's just not appropriate. UMC 500 beds, and then you bring in something and replace it with a hospital that's less equipped to meet the needs of 2 wards that have at least 150,000 residents. Even if you have level 2 trauma, it's not going to be able to meet the need because you have to address the size, right, and the number of beds. I would definitely note that we definitely need a neonatal ICU unit because we have the highest infant mortality rates, and none of the other candidates mentioned this. Infant mortality is a concern for Black women. It's a concern for me as a Black woman. It's a concern for my friends who have had babies. I know women personally who have had strokes during childbirth or not listened to by their providers, which is why the community-based model is the key for this, so that we have doctors who are listening to our concerns as African-American women. And do I have time to squeeze in on the need for
Time is out.
a triage? Okay, all right, but I could keep going. Thanks, Bennett.
So that's our 3 questions. And again, we're running ahead of schedule. So I'll consult with the organizers if we want to do a bonus 4th question or go ahead to the Ward 7 race. Oh, Kent, you're on mute.
Once again, trying to be considerate and not make noise. I'd say let's do a bonus 4th question. We have a couple of candidates that confirmed for Ward 7 who have not joined yet. And I've reached out to them to tell them that we're running fast. So hopefully by the time we do a 4th question and community statements or member statements, we will have them online.
Also, if I may, Kent, I sent you a chat, and there was an email we received from one of the speakers who's going to come up for later portion of the link. And Fenn, we got a comment. Some people are saying you were a little soft, so if you could maybe speak a little louder.
Yes, I can.
Thank you.
All right, so the 4th question, the bonus question. As Councilmember White mentioned earlier, SMILE had recently opened up a new transitional facility for homeless LGBTQ youth in Ward 8 last year. As a council member, what would you do as a community leader to make LGBTQ youth feel comfortable in their communities in Ward 8 and feel like they're accepted? We'll start off with Councilmember White.
Thank you. That's a great question. So what I will do, I can talk about what I will do, but I will talk about what I have done and continue to do. Just a couple of days ago, I met with some members of the LGBTQ community, just asking questions, listening, trying to get some understanding, and going to this next budget cycle, how we can be effective in ensuring we get not just we want, but what we need. We have the largest population of LGBTQ residents here in the district, and we want to be that community to embrace them, love on, and provide resources for them. So we've been very innovative. You'll see in the future, as I spoke of before, about creating recreational opportunities, business opportunities, and just a sense of inclusion in our ward. And so I've been an active voice in doing that. You'll see more from me doing that as time progresses.
Yaida Ford, what's your response on how you would as a community leader make LGBTQ youth feel comfortable in their communities?
Thanks, Bennett. So I'm an artist. And so as an artist, I understand the importance of using artistic expression to talk about topics that are taboo and to address some of the stigma that our youth are feeling. I mean, there's a big sense of rejection for LGBTQ plus youth at home and in other spaces and in schools. They'll miss school because they're dealing with issues there. So it's all about creating safe spaces for youth. So I would like to create an artist colony that would provide a space for our LGBTQ plus youth to use their artistic gifts as a sense of artistic expression, so we can actually then have that conversation and engage on the really sensitive issues that are facing our LGBTQ youth. I also want to connect that too with seniors and some of the isolation that some of our LGBTQ seniors feel, and present the artistic, kind of create some artistic opportunities for our LGBTQ youth to display and exhibit their talents to a captive audience, which would be our seniors and our LGBTQ plus seniors, who, again, isolation is a big deal. And so being able to merge, the need for our youth to express themselves and merge the need for our seniors to be entertained and feel less isolated, it's a just creative, innovative way. And as an artist, I have music videos, I write songs. So I know that that's a tool to use to push the issue and create safe space for people, particularly our youth. Thanks, Bennett.
Thank you. Mike Austin, what would you do to make LGBTQ youth in Ward 8 feel accepted and welcomed?
Absolutely. Our LGBTQ youth face some serious barriers just for living in their truth. And so we need to make them feel comfortable as they live their truth and, really embrace their identities. First, I would say, really use my committee when given one to really create safe spaces and fund those initiatives to make them feel safer, to put money in some of our schools. We have so many underfunded schools this year alone that nobody really talks about. And we've lost services as a result of that. And so I want to ensure that out of my committee, that our money shows our priorities and that we're putting money behind these policies and really our budget priorities. And so making sure that we have safe spaces, whether in the schools or in the recreation centers, or in other environments, so that our queer and LGBTQ residents as a whole really have a place to express themselves and to really live in their truth. And so, I don't think we have to really try to come up with some wild, fancy answer. I think it's just putting our money where our mouth is and really creating the safe space for our young people to be themselves.
And Stuart Anderson, you get the last word in the Ward 8 candidate forum. So what would you do to make queer youth in Ward 8 feel welcomed and accepted in their community?
Thank you very much. I appreciate it. I want to say first and foremost, the most important thing I believe that we need to be doing is listening. Listening is so important. There are so many members of the LGBTQ community who, our youth and others, who are disproportionately suffering from all sorts of kind of the hazing and the shunning and the substance abuse as a result of those things. There's also the mental health problems that come from just trying to express your personal identity to a world that says something other than what you profess to be. And we just have to have understanding for that. I want to say that as the next council member, Ward 8, I'm going to come in with that kind of compassion. I'm going to ensure that the trans community has the type of voice that it needs.
All right, well, thank you to all of our Ward 8 candidates for coming out here tonight and for adjusting to this brave new world of Zoom debate candidate forums and phone banking and not much door knocking.
Yeah, thank you. Thank you all.